we're finding out there's people out there that really do qualify for insurance, but they don't know it, or they need help to get on it. And it'll make the whole medical system work better if these people have some insurance and have someone to hold their hand to get them into the medical system. This is the work for a community health worker, someone that's out in the community. We're needed.
Improving access to healthcare information and services is the goal of the Rural Ag Health Community Worker Project, being piloted by the state's extension system in more than a dozen counties in northeast and southeast Kansas, including Marshall County. With financial support from the K-State 105 program, Marshall County has hired Arlene Wessel, a retired nurse and adult care home administrator, as a community health worker to support and expand the work being done by Marshall County Extension Family and Consumer Sciences Agent and Director of the CHW Project, Susie Latta. On today's Sound Living, efforts to improve healthcare education, services, and resources in rural Kansas. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. As we noted last week, partners in the project are recruiting and hiring 5 community health workers who will be based in several extension districts, including Wildcat, Southwind, Meadowlark, and River Valley, along with Marshall County. This week, Johannes joins Marshall County community health worker Arlene Wessel to discuss how the CHW program there is already helping people with a variety of health care issues. Arlene, first off, maybe just some background. Why did you choose to be a CHW with Marshall County Extension in particular?
Well, I guess it's kind of a long story. I'm a retired nursing home administrator, and I'm also an RN, and I had worked with our Marshall County Extension agent, Susie Latta, professionally for years. Sometimes she helped provide advice or helped my clients enroll in Part D, and we had done maybe some health fairs together, so we kind of knew each other. She knew I was retired and that I knew a few things about Medicare because of my previous position, and she said, "Hey, how would you feel about volunteering? You know how to sign people up for Part D, and we could do some things together. What would you think about that?" And I really kind of felt honored that she asked me. And frankly, I was ready to get out of the house and see some people again. So I started volunteering here in her office, and she was very supportive and held my hand and made me feel that, yes, you can do this, you're fine. And then after about 6 months of volunteering, she says, well, it came through. We got a grant from K-State 105 for a project on community health workers, and I've kind of been thinking about you. It would be about 3 days a week. You would get paid, and you would be doing things similar to what you're doing as a volunteer now, but more. Have to take some classes and certifications, and she was encouraging me, so that's how I got here. I'd rested up long enough from retirement, and I like working with Susie in the extension office people. I'm both a farmer and an RN. It just seemed like a good fit. A lot of people know me probably from running the nursing homes, and I can relate to farmers. It just seemed like a good fit for me to be a community health worker in our rural areas. It felt like I fit the definition of the kind of people the grant was looking for to do this work.
In terms of the certification, what was the process like, and how intensive was it?
Well, because I was already a registered nurse, it wasn't so intense for me as it would be for someone who did not have a nursing degree, because I got a lot of credit for my work history and for my very well-rounded nursing education. For me, I just had to prove a lot of that, and then I had to take a lot of courses through the Kansas Department of Health and Environment and pass tests and be certified, and those are ongoing, by the way, to make sure that a community health worker, someone that's helping people enroll for Medicare and Medicaid, Medicare Part D, the government wants people that know what they're doing to be assisting with this. and in a way representing them.
And I may step in.
Sure.
I appreciate that Arlene has described very well a career track to CHW certification. Kansas is one of 12 states that certifies its CHWs now. There are other states coming on this coming year. And there are two ways that CHWs can be certified in this state. The first one is what Arlene has described, a professional such as herself who has already got credentials, licensing, filling out some forms, Arlene, that you had to do, submit, and have it approved by the Kansas Community Health Worker Coalition.
Yes.
And the coalition then does certify all the CHWs in the state that they can actually work within the scope of work. But the other way is through the 160-hour course.
Yeah.
And if we have CHWs, which we do in extension offices, who don't have the experience that Arlene has, they would then be enrolled in the 160-hour content and service learning course, complete that course, and then get their certification done.
Arlene, maybe once you got the onboarding process done through the extension office, what were some of the things that you wanted to focus on first? What were some of the primary areas that you thought maybe you could lend your expertise in?
The nursing home is an area because I have expertise there in helping those people get signed up for Part D and shopping for the least expensive Part D program that would cover them. I also learned how to sign up people that were still working, sign them up for Medicare when they turned 65 years of age, and educate them about supplemental insurances if they were thinking about retiring from work. I also got to help people sign up for Social Security. And then in between there, I saw a lot of clients that were older and had limited incomes, and I was able to help them get extra help so that they could afford Medicare benefits. That was the main thing, but meeting people to do this kind of opened a window where they would talk about other concerns that they had, like transportation to the doctor was needed, or that they didn't understand their explanation of benefits from Medicare. And then actually, they would reveal other concerns to me, like they were concerned about stress, that they wanted to be able to keep working if they could do something about the stress, or about concerns that they had with their elderly parents. And, then it's like, well, I can help them understand their insurance claims or see if they're eligible for some assistance so they can keep their Medicare. Just kind of opened the door to seeing that people have other concerns, their own health, hypertension or their diabetes or weight loss. Different problems came up, and because of that, we are thinking that we might offer a class on self-assessment for hypertension, maybe some diabetes classes and some balance classes this winter.
And Jeff, the way Arlene has described how she's the gateway for other health concerns is ideal. This is how a CHW typically works. They are available to the community. Their scope of practice includes community education, community events, and then listening with that third ear on there's other issues going on. So the way she's described how the Medicare Part D, how the prescription, then the opening of worry about my parents, worry about my job, and then now let's talk about stress, let's talk about hypertension, diabetes. That's actually the practice of a community health worker who understands how people gradually will open up to additional health care concerns, but also health care opportunities. So, Arlene, what you're describing is why we think extension is a good place for community health workers to launch from.
Also wanted to talk about your collaboration with Valley Vet in Marysville. What's going to be going on with that project?
We have a good working relationship, I think, with the HR director there at Valley Vet, which I think employs around 100 employees. And I guess actually it happened because the HR person was asking for some assistance for one of her employees who needed some assistance with their parents. And you see, that kind of assistance would help that employee be able to keep coming to work if we could come up with some ideas. So we referred that person's parents to some people, and it made us think, I bet she has other employees that we could help. So actually in November we have 2 days set up where we're going to be there in their workplace. And already I know approximately 15 people have signed up to talk to us about they're still working, but they know that they need to get signed up for Medicare on time, and they're, going to be looking at their insurance benefits versus maybe signing up for Medicare Part B and buying a supplement. And we're also going to be talking to them about different programs that they have at work regarding weight loss and possibly learning how to self-assess their blood pressure. And we've already found out that a few of them are going to be asking for some assistance regarding their spouses, which are already Medicare age, and for their parents. So we're just going to go meet them where they are, help them with anything that we can help with, but also I'm sure we'll be learning other social and health-related items that they're needing help with, and then we're going to research and see what we can do to help with that.
Well, this is interesting because I think what you're discovering in Marshall County is it's an issue that we're seeing probably all across the state and in other states. And you're not only discovering, I think, what we already knew, but you're finding ways to help larger groups all at one time and maybe even targeting some programs that will help others throughout Marshall County and maybe even across the state.
Yes.
I may jump in here.
Go ahead.
I apologize.
Fine.
When we think about the scope of practice of a CHW nationally and then in this state, Arlene's work in rural frontier is unique. CHWs have been in the United States in mostly metropolitan urban areas for quite a while, where there's a large client pool and a lot of providers. When we think about rural frontier and access to care, that's a pain point. So a CHW such as Arlene is not only identifying supports for people, but she's identifying gaps. And those gaps hopefully will be heard by not only the provider systems, like Arlene, you're working with your public health department, there's other providers and clinics, but the gaps that Arlene and then Susie are also identifying will be listened to by the community, the chamber, the city council, philanthropists, foundations. And so the scope of practice includes advocacy for filling gaps. And Arlene, I bet when you start going out to Valley Vet and you have a whole slew of people saying, oh, I've got this concern, that concern, you're going to be keeping track of those gaps that maybe the whole community can rally around to fill.
Yes, you bet. I did some talking with a social worker from a neighboring county, and she had the benefit of utilizing the help of a community health worker for a short period of time, and she said, yes, it was so helpful because this person was able to help people, fill out Medicaid applications, help their clients remember to come to appointments, help get their clients a basic insurance coverage so that they could be seen by a physician and the local hospital could get some reimbursement. We're finding out there's people out there that really do qualify for insurance, but they don't know it or they need help to get on it. And it'll make the whole medical system work better if these people have some insurance and have someone to hold their hand to get them into the medical system. Physicians don't have time to do this. This is the work for a community health worker, someone that's out in the community. We're needed. If we don't get people to the care, their health is going to be poor and expense to the system is going to be high. Outcomes are going to be poor. I think we can really help close some gaps.
That's Marshall County Community Health Worker Arlene Wessel and Elaine Johannes, the Kansas Health Foundation's Distinguished Professor of Community Health at Kansas State University, with an update on the impact the CHW project is having in Marshall County. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.